Hi guys, this is Charles. I'm one of the surgeons at Southpaws. This is a CT scan that we've just done on a dog that presented to me for a rib mass. Incidentally, it does not have a rib mass, but it did have what looked like severe cervical pain. When I squeezed on its neck, I got a lot of cervical pain response and yelping and that kind of thing. So we've done a CT scan, and we can see this is at about the C3-4 level. We can already see a bunch of disc material that's in the canal. Heading back, more disc material here, more disc material there, even more disc material here, more disc material there, even more there, heading all the way back to about C6-7. So this is one of the most dramatic disc ruptures I've ever seen in a dog, and the dog came in with no neurologic deficits at all. It just presented for this potential rib mass, and then when we examined it, found out that it had a lot of cervical pain. So I'll just show you on the sagittal slice here. We can see all of that disc material. You can see the collapsed disc space at C5-6, and then all of that disc material that's in the spinal canal. So that's one of the most dramatic ones I've ever seen. I've been doing this a long time. So we're about to take it to surgery now. I am not going to live stream it. I don't have consent from the owners, but I hope to potentially live stream a different cervical disc later on today. So thanks again for watching. Let me know if you have any questions.